This past April, I had fraternal twins that were born 6 weeks premature. I was taken to St. Luke's Hospital and overall spent 25 days in the hospital in the neonatal intensive care unit. This experience piqued my interest in twins since they are now the center of my whole life. According to Pinov 2018, bonding between twins happens in the womb as early as 14 weeks gestation. They will reach out for each other. Although not everybody may know a set of twins or have a set of twins in their family, I bet I can give you some interesting facts that will help you understand the experience better. In this speech, I'll take you through the whole entire process of having twins. I will show you some of the increased risks of having twins, and I will end with the likelihood of having them in the first place. To understand twins, you must first know the difference between having twins and having one baby. The difference between a singleton and twins is that women have enhanced pregnancy symptoms. According to Fiera 2019, edema, which is swelling in the legs and feet, can get much worse close to birth. It can even double. Women also have increased nausea and fatigue carrying around 2 babies instead of 1. And according to Fiera, women's bodies will adapt to accommodate 2 fetuses. This means that they can gain more weight and become larger. Women having twins can expect to gain an extra 10 to 15 pounds during pregnancy. This makes it difficult to be on your feet for long periods of time. It also makes it harder to work and harder to do daily household chores. In addition to these enhanced symptoms, there are also increased complications when it comes to twin pregnancy. Women will require closer medical care. These higher risks include preterm labor, preeclampsia, pregnancy-induced hypertension, and gestational diabetes. These conditions must be closely monitored because they can affect not only the mother but the babies as well. When you're pregnant with twins, you can expect to see the doctor more frequently. You can see the doctor every 2 weeks or even every week leading up to the birth. Pregnant women must be sure to maintain adequate fluids, eat a healthy diet, and minimize their physical activity that may put the pregnancy at risk. Now we can look at the likelihood of having twins in the first place. If you had already had fraternal twins, then your likelihood of having twins increases significantly. It will increase to 1 in 12. If you have had fraternal twins and you're on fertility drugs, then your chances of having fraternal twins again is 1 in 35. However, there are also other factors that will increase your chances of having twins in the first place. If your mother is a fraternal twin, you already have a 1 in 17 chance of having twins. If you're over 50 years old and you get pregnant, you have a 1 in 9 chance of having twins. Now, as we come to a close, I hope you have a better understanding of how a twin pregnancy is different than a singleton. Now, as you see families in public that have twins, or you have twins in your family, you can look at the mother and know what she went through to have those babies. You can also just look at those babies and think, thank goodness that isn't me carrying around and chasing not 1 but 2 babies everywhere.